Welcome. Welcome to the 2017 pinning ceremony for the Barton Community College nursing programs. I'm Dr. Kathy Kotis, the Executive Director for Nursing and Healthcare here at Barton. We're honored to have you here with us to celebrate today and to celebrate the accomplishments of these students. As we begin today, I would like to share with you just a few special introductions. First of all, I would like to introduce our nursing faculty, and they'll be seated here in the front. First is Mrs. Susan Bauer. Stand. Susan joined us in March of 2017. She helped with Maternal Child 1 this year, and then next year will help with Maternal Child 1 and 2, Fundamentals, Gerontology, and Pharmacology. Mrs. Kara Brower. Kara joined us in August of 2015. She teaches RN Leadership and Management, Med-Surg 3 and 4, and Mental Health 2. Mrs. Brenda Glendenning. Brenda joined us in August of 1990. She teaches RN Leadership and Management, Med-Surg 3 and 4, and Mental Health 2. Mrs. Carla Johnston. Carla joined us in August of 2014 and teaches Fundamentals of Nursing, Med-Surg 1 and 2, Pharmacology, and Gerontology. Mrs. Jill Lawson. Jill joined us in January of 2013. She teaches Maternal Child 1 and 2, Mental Health 2, and helps with Med-Surg 3 and 4. Mrs. Shannon Schreiner. Shannon joined us in September of 2015. She teaches Fundamentals of Nursing, Med-Surg 1 and 2, Pharmacology, and Gerontology. And then Mrs. Renee Skelton. Right back here. Renee joined us in August of 2014, and she teaches Fundamentals of Nursing, Med-Surg 1 and 2, Mental Health 1, and PN Transition into Nursing. And not able to join us today, but I would like to recognize our nursing secretary, Josette Luttrell. At this time, it is my honor and pleasure to introduce to you the president of Barton Community College, Dr. Carl Heilman.
Welcome. Just gorgeous outside, no less spectacular here inside. Just could be more proud, we could be more proud of our graduating students today, putting in a full measure of effort and sacrifice leading up to this moment. Congratulations to each of you. Wonderful job. On behalf of the Barton trustees for this college and all the faculty and staff, we welcome you to the 46th annual nursing pinning ceremony. I wish to underscore my comment of heartfelt congratulations. This is my 30th consecutive nursing pinning ceremony that I've been so fortunate to be involved. Barton is certainly unique and is blessed in having a quality nursing education program and most capable nursing graduates. For me as an educator, this ceremony represents the individual graduates who possess a passion and a commitment to serve others, a passion and a commitment for self-betterment, and a passion and a commitment to the value and significance of life. This ceremony represents rich tradition and involves the finest of people. Barton is pleased that you have joined us this afternoon in recognizing the accomplishments of our nursing students and the commitment of our faculty and staff. I certainly hope you enjoy the rest of this afternoon. I know I will. Thank you for joining us.
Today is a culmination of months of very hard work and dedication. I know there have been days when you all questioned, why did I even start this journey? Was it all worth it? But hopefully today you know the answer to those questions. Each of you have made many sacrifices and spent endless hours of studying and sacrificing on the part of your family and work and everyone around you. Now it's time to celebrate. 10 months ago, we started together and we began talking about teamwork. You all have truly exemplified what a team is. You have worked together, you've supported each other, and have truly grown stronger into the professional individuals that you are with a common goal. I would like to take just a few minutes to introduce the graduates to all of you in a special way that we like to do each year. This is a way that I think will help illustrate some of the sacrifices that many of the students have endured over the last year or 2 years. So, graduates, please stand if my statement applies to you. I drive at least 5 miles one way to attend school at Barton. Okay. Remain standing if I drive at least 10 miles one way to attend school at Barton. Okay. Remain standing if you drive at least 20 miles one way to attend school at Barton. Remain standing if you drive at least 30 miles to attend school. Stay standing if you drive at least 40 miles one way to attend school. Remain standing if you drive at least 50 miles one way. Okay. Remain standing if you drive at least 60 miles one way. Okay. Remain standing if you drive at least 70 miles. Do I hear 80? Please stand if you are single. Okay. Please stand if you are married. Okay. Please stand if you have at least one child. Okay. Remain standing if you have at least 2 children. Remain standing if you have at least 3 children. Remain standing if you have at least 4 children. Remain standing if you have at least 5 children. 6 children. Julie's the winner. How many, Julie? She has 7. Stand if you worked part-time or full-time during school. Okay, good job. Thank you, students. This exercise shares only part of the challenges that these students have faced during the last 1 to 2 years. There have been many more, and they have risen to those challenges, so congratulations, graduates. Now, our speaker for this afternoon, Mrs. Renee Skelton. Mrs. Skelton began her nursing career in 1991 and her teaching career here at Barton at 2014. Mrs. Skelton has had a special bond with her students over the last 3 years because she has also been a student and will soon finish up her Master's of Science in Nursing. Mrs. Skelton is also an alumni of Barton's PN program, so we're proud to have her back as faculty. Now may I introduce Mrs. Renee Skelton.
Well, good afternoon, everyone. I'd just like to start by thanking the students for the honor of speaking today. It really touched my heart that you chose me. As Dr. Kotis mentioned, I do have a little something extra in common with these students, besides just wanting to be the best nurse that I could be and giving high-quality care to my patients, but I'm a student also. So firsthand, I admire you for the sacrifices that you have put in to get where you are today. I know firsthand the number of times you had to say no to something fun because you had chapters to read, tests to study for, homework assignments to finish, but you did it, you persevered, you got it done, and here you are. So could we have a round of applause for all of these students? So Dr. Kotis kind of let the cat out of the bag about how long ago it was that I sat in your chair, but I was just going to say 20-some years ago, I sat where you're sitting. And I remember sort of being envious of the students that were getting degrees in business or in agriculture because they could just go out and go to work the next week. But as nurses, we still have that one obstacle in front of us, that NCLEX. So I know that the thought of remediating Kaplan, practice questions, going over your tests, has you begging for Zofran and makes you sick to your stomach. But if you're not going to get yourself ready, and you're not going to prepare, and you're not going to give that NCLEX your very best shot, then who is? My question is, if not you, then who? So when your patient is suffering in the night, and they have pain, and the medication isn't doing it, if you're not going to step up and call that provider and get something different, then who is? If not you, then who? If you have a family who feels like their needs are not being met, that nobody is listening to them, if you don't step up and advocate for them, then who is? Who's going to be the voice for those patients? You are. Because if not you, then who? So when I thought about what did I really want to say to you today, I thought about things like opportunities that were coming your way. And I thought about things like jobs in prestigious hospitals around the country, like Johns Hopkins or Mayo Clinic. I thought about nice cars and fancy houses. And then I got to thinking about that, and I realized that an $8,000 car, an $18,000 car, or an $80,000 car still just get you from place to place. And when I thought about a big house, I thought about all that dusting and carpet vacuuming and cleaning, and I thought, oh, I don't think I would wish that on anybody. So what I decided was that I wanted to, my greatest wish for you is that you will all be content. Okay? Whether you get a big prestigious job in a fancy hospital or you stay right around Barton County, I want you to be content. And I define contentment as this: an emotional state of satisfaction drawn from being at ease in one's situation, body, mind, and a state of peaceful happiness. Maybe it's more important not what kind of car you have, but who's in the car with you, the people that you have in your life. And I hope that you can surround yourself with people who admire your better qualities and can overlook your faults. There will be times in your life when you don't feel content because you're not in a work situation that's meeting your needs. You're not allowed to give the best care because you're understaffed or overworked. But this education that you're receiving today gives you opportunities. So take that step. Try something new. If you're not going to make your situation better, who is? If not you, then who? There will be times perhaps in your life when you find yourself in a relationship that isn't meeting your needs. If you're not content, make a change. do things a little different than you have before. Because I'm old enough to know there's no magic wand. And if you don't make things happen and you don't make changes, they never will. So again, if not you, then who? So I think I'm close to 5 minutes. And my husband told me this morning, he said, Renee, if you can't say it in 5 minutes, it doesn't need to be said. So I'm going to wrap it up. So I've told you that I'm proud of all your accomplishments. I gave you a rousing pep talk about getting ready for that NCLEX, right? I told you to get out there and do hard things for your patients. Be that patient advocate. Be that voice. And I told you that what I want most for you is that you be blissfully happy. So I guess the only thing I have left to say is get out there and make your dreams come true, because if not you, then who? Thank you.
At this time, if the PN faculty would want to come forward, we will begin by awarding the pins to the PN graduates.
Ashton Brady. Rex Cruz. Carla Frink. Chelsea Hernandez. Emily Johnson. Julie Keller. Allison Kirkendall. Caitlin Klein-Martin. Tanya Pike. Rochelle Powell. Rebecca Riebel. Becky Reeves. Levi Rios. Australia Sharts. Janelle Stuckey. Joella Tobin. Hypatia Wallace. Kelsey Ward. Katie Weber. Congratulations, PN students. We're really proud of you.
Okay, at this time, we will pin the ADN graduates.
Megan Ackerman. Lindsay Alt. Casey Case. Emily De Laurentiis. Danielle Dethridge. Tabitha Greathouse. Brittany Harrison. Brooke Henning. Caitlin Koralik. Morgan Kurtz.
Sherry Lindeman. Jamie Martinez. Hattie Montoya. Caitlin Murphy. Kathy Noakes. Audra Rothstein. Yadira Sorsini. Ashley Till. And Jamie Waters. Congratulations to the ADN class.
At this time, it's been a tradition to participate in the candle lighting ceremony, and so we will begin that at this time. Okay. As healthcare professionals, we take an oath to do no harm. On the back of our programs today is the Florence Nightingale Pledge. This pledge was modified from the Hippocratic Oath, and it was composed in 1893. Even though some of the words seem outdated, it is still very relevant today. At this time, I would ask that our graduates remain standing and also invite anyone in the audience that is a nurse to stand and join us in the reading of the Nightingale Pledge. Okay. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Graduates remain standing. Following the pinning ceremony this afternoon, please join us in the Barton County Union, which is the next building just to the west, for refreshments and a time to congratulate our graduates. It is with honor and great pride that I present to you the 2017 Practical Nursing graduates and the 2017 Associate Degree Nursing graduates of Barton Community College. Congratulations.